My name is Leslie McKinney. I'm the Assistant Clinical Director at Sage Neuroscience Center. Sage Neuroscience Center is a multidisciplinary integrated care clinic. And what we do here is we work with a team of providers, psychiatric prescribers, counselors, therapists, medical assistants, and primary care physicians to treat the whole person. Our goal is to address all of the needs of all of our clients. At Sage, we offer primary care services, we offer medication management, and we offer a full spectrum of outpatient therapy services. So really this means that we can help anybody who is coming out of a hospital setting or somebody who's just having a rough time in life and they need a little extra support. One of the things that really makes Sage Neuroscience Center so unique and so special is that we really do have the resources to treat the whole person and create a treatment plan that is unique for each individual person based off of evidence-based practices, best practices, and then integrating all of the different care models and care teams that they need to reach their treatment goals. Our substance use disorder team really focuses on treating the whole person. Our intake department will do a brief screening, and that will help us decide where is the best place for you to start. Some people start with our detox providers to identify a safe way to stop or to stay off of a substance by using medically assisted treatment. Additionally, you'll engage in a psychosocial intake assessment with one of our substance use disorder specialist therapists, and they'll help you decide what level of care is appropriate. Maybe you need to start with an IOP, or maybe you're ready for just some one-on-one counseling. Our goal is to really help identify what is best for you within an evidence-based model. So once you've completed the detox process, which for each person that's going to vary, or you've completed the intensive outpatient program along with some medication management if needed, then you're going to do some one-on-one counseling and even participate in one of our aftercare support groups. We're able to offer the full spectrum of care for outpatient services for substance use disorder treatment. The Aftercare support group is designed to offer support, to continue community, and to continue skill reinforcement after the IOP has been completed or as a result of additional care with one-on-one care. Our substance use disorder team is also ready and willing and excited to work with our rural population in New Mexico. We're interested in working with your primary care physician and other people in your community to collaborate on your care and to help you get your needs met through telehealth and through financial assistance. The Behavioral Health Intensive Outpatient Program is part of our Behavioral Health Outpatient Spectrum of Care. So this is designed specifically for individuals who are suffering with chronic or long-term mental illness, are having an acute and intense onset of symptoms, and maybe that individual is trying to stay out of the hospital, or they're just getting discharged from a psychiatric hospital. Our goal is to help individuals each develop a skill set that helps them manage the symptoms that they're going through and the symptoms that are bothering them. We do this by increasing skill use, by evaluating skill implementation, and by looking at how we're spending our day and how we're spending our time and energy. The ABH-IOP is a program that is designed specifically for adolescents and their adults. The Adolescent Behavioral Health IOP is for clients between the age of 12 and 17. And we start by doing a screening to identify the goals and the needs of that patient and to identify an appropriate adult that can attend all of the group sessions with that client. We know that offering our adolescents support and consistency outside of the ABH-IOP to learn to implement the skills that they learn in the group is the best thing that we can do. Seeking Safety is a group that is designed specifically for people who are struggling with co-occurring disorders of PTSD and substance use disorder. Seeking safety is exactly what it sounds like. How are we seeking safety within our substance use disorders as a result of trauma? Seeking Safety is designed to help build skills, build community, and build a plan so that staying sober is possible in the face of trauma. Medication management is a service that you can do all on its own at Sage, or it can be part of your wider treatment plan. Medication management will be done by a psychiatric specialist or a psychiatrist on staff. The point of medication management is to help you address the symptoms that are causing you disruption and then to help you get to what your treatment goal is. Your provider may make some recommendations along the way about therapy or different group services or even some supplements to try. Your medication manager's goal is to help you achieve whatever your goal is. So at Sage, we actually have an in-house pharmacy, and one of the cool things about this is that we can work directly with our patients. Sometimes we can help a patient by bubble packing their medication so things don't get confused, or we can have it refilled even as quickly as after their appointment. The prescriber can submit their refill and submit their medication changes, and then it goes directly to our pharmacy. However, you don't have to use our pharmacy. You're welcome to use what pharmacy is the most comfortable for you. Our primary care office is here inside Sage, so it's actually in the same clinic as the rest of our providers because we believe in integrated care. The primary care office, they can help you address pretty much any of your primary care needs. We can help you handle anything from a minor sinus infection to managing a chronic illness. If you have questions about whether Sage Neuroscience Center's primary care can help you with your illness or symptoms or concerns, give us a call and ask one of our medical assistants for some further information. TMS, also known as transcranial magnetic stimulation, is a treatment that is designed for treatment-resistant depression. The idea is that there's a non-invasive device that is set on the edge of your head that directly sends a magnetic pulse to a part of your brain that can often be understimulated when a person struggles with depression for an extended period of time. There's some different criteria that need to be met to be eligible for this service. However, most of the people who do give us a call and do identify TMS as a service that they'd like to do meet the criteria. Ketamine treatment is also designed for treatment-resistant depression. However, it can be used for other diagnoses like PTSD, OCD, or other anxiety-related disorders. So the treatment dosage and frequency can be decided between you and your provider. The typical dosing is once a week for 8 weeks. At Sage Neuroscience Center, we offer therapy for children, and then we also offer medication management for children. For medication management, we can work with somebody as young as 4, and for therapy services, we can work with somebody as young as 10. We have providers who work specifically with children and adolescents, and then often integrate the care of their families or the adults in their life as needed. Through COVID-19 and social distancing restrictions, we have been able to offer telehealth to our current client population and then continue to take on new patients, even expanding to offering care to rural populations here in New Mexico. If you're seeking mental health services or primary care services, we do offer that via telehealth. For those that do need in-person care, you can contact our facility and let us know that that's a preference. There are some of our services that we do have in person, such as our primary care is an option, our detox services are in person, and then some of our psychiatric medication management or even some of our therapy sessions, depending on the need of the individual. If you have questions about this or you have concerns, that's definitely something that you can call and talk through with us. What I really love about Sage is that I can really tell our providers work really hard to meet the needs of individuals that come to Sage. We work hard, we collaborate together, we do all have access to the same charts and notes, and so we spend a lot of time making sure that we're reaching the goals and sharing communication and information about a patient that could help enhance their care and enhance their outcomes. Providers and staff really do offer care with as much consideration and compassion and evidence-based treatment as possible. We want to help them really access their highest quality of life. And quality of life is really, that's totally different for each person depending on what they're going through, where they're coming from, what their resources are. And so we really work to open the door as much as possible for everybody. And at Sage, we really believe in the human capacity for change and growth. The term neuroscience, we know that can sometimes confuse people, and the whole point of that term being in there is it really identifies and discusses the process that's happening in the brain, and the process of what is happening within the brain and the body, and the way that we respond, and the way that we're designed as humans to respond to our environment. That's really something that we take into consideration as a strength of the human capacity for change. And we put that information into practice for that evidence-based treatment to get the greatest outcomes possible.